In this video, we are going to talk about why nutrition is important for someone with head and neck cancer. We will also give you tips on how to get enough nutrition before you start treatment and maintain a healthy weight. Treatment for these types of cancers can have different side effects that make it difficult to eat and drink. Eating well is essential for your well-being. Before, during and after treatment, it is important that you maintain your weight as much as possible. A diet high in protein and energy will help you do this, as well as help maintain your muscle mass. Eating well will also help you to get through treatment, reduce the risk of infection, recover more quickly, keep your strength and energy levels up, and increase the effectiveness of treatment. Protein helps the body heal. It also reduces the chance of infection and helps you to maintain muscle. Foods that are high in protein include meat, poultry, and fish. Other great sources of protein can be found in eggs and dairy, soy milk and tofu, and nuts, legumes, and pulses like baked beans, chickpeas, and lentils. Energy, or kilojoules and calories, is needed to help prevent weight loss, help you regain weight, and prevent the loss of muscle. Energy is highest in foods with added fat and sugar, so go ahead and add that extra margarine, butter, and oil. A dietitian is a university-qualified expert in food and nutrition who helps you with your diet. Your dietitian will help you work out a plan to get all the nutrition you need. They might give you some tips to make eating and drinking easier. These will help you stay well nourished and hydrated and maintain your weight.
A speech pathologist is an expert in communication and swallowing. Being treated for a head and neck cancer can affect your ability to speak and/or swallow. These changes can be temporary or lasting, and they could impact your daily life. Your speech pathologist can give you advice on how to make eating and drinking safer and also more comfortable.
It is important to do your best to eat well and keep your weight stable before treatment. If you can't eat or drink well, this can lead to unplanned weight loss, a loss of strength, and you may become dehydrated. Here are some tips for before you start treatment. Eat a diet high in protein and energy. Try to establish a regular pattern of eating 3 meals each day with snacks in between. If you are having trouble eating full meals, try eating smaller meals and snacks more often. Keep your fluids up. Aim to drink 2 litres per day, and whenever possible, make it nourishing liquids, like a milkshake with extra ice cream, smoothies, or a juice. Make meals ahead of time and freeze in meal-sized portions. Keep a food diary for a day or two and show it to your dietitian. This will help them suggest ways to personalise your eating pattern. During treatment, food texture can become very important. You might need to modify the texture of your food and how it is cooked. This will change the way you prepare food at home, so you could find yourself using some kitchen tools more often than usual. To prepare food that is soft, mashed, minced or pureed, here are some kitchen utensils that might come in handy. A fork or a potato masher, an egg beater or a whisk, a strainer, a food processor, blender or bar mix, and a slow cooker. Your dietitian might recommend high protein, high energy nutritional supplements to take during treatment. If your dietitian has recommended nutritional supplements, they will give you information on where and how to buy them. There are also foods that are high in protein and energy available in your supermarket. These include yogurt-based drinks, Up and Go, and milk powder. It's a good idea to learn where these items are in the supermarket. They can usually be found in the aisles with dairy, cereal, or long-life milk. Another thing that can help you make sure you are getting optimum nutrition is reading food labels. They can be confusing and tricky to understand. When you're shopping, make sure to have a good read of the food labels and choose products that have the most protein and energy. Being treated for cancer often means you end up spending a lot of time at hospital and attending appointments. so preparing food in advance and taking snacks in a cold bag is a good idea.
It's very important to take care of your teeth and your mouth. Infections can be harmful and slow down your treatment. It's a good idea to have a dental checkup before you start treatment. Your dentist will check the health of your mouth and your teeth and give you a plan to keep your mouth healthy. To get a head start, here are some things you can start doing now before you start treatment. Drink plenty of water and chew sugar-free chewing gum to keep your mouth moist. Gently brush your teeth, your gums and tongue with a soft toothbrush after every meal and also at bedtime. Gently floss your teeth every day. Use a high-strength fluoride toothpaste. And lastly, use an alcohol-free mouthwash.
Eating well is essential for your well-being. Before, during and after treatment, it's important that you maintain your weight as much as possible. Eating well will help you to get through treatment, reduce the risk of infection, recover more quickly, and keep your strength and energy levels up. Your dietitian is an expert in nutrition. Good communication with your dietitian is very important to help you get the best care before, during, and after your treatment.